Koram gajwang mano nonro ma dhi nyime e od bura mamalo kutenore kod lal mar stima mano timore pacho kaendi chiegni dwe achiel mokadho ma kuonde mathoth e pacho kaendi gin mago mane onge kod teko mar stima kendo oganda ne obedo kod ng'ur makoni kod kocha jogo machendo mag ne orochore kagesa ni kamati mar od bura dhi nyime gi dadho kendo ng'iyo kuma ng'ukni no bedi winjo ka giwacho kanyo poni ne en kama inyuole teko stima ma Turkana kata kama keyo teko stima moro ma opogore. Report motenore kod mani bwede weche manyien kinde mag odhiambo. Ka dhi nyime riwruok jotije mano FKE oloso twak gi jofwambo ewi medruok nengo mauta. Mano medo kinyi ma kawuono ka bende gitwak ewi osuru masani deo jotije ma pacho ka. Wawinjane kaka gitwak bende achiel kachiel ewi wachno.
The total wage employment. The envisioned contribution by every Kenyan also poses major challenges. As envisioned by the Constitution and the tripartite labor sector arrangements, the Federation champions meaningful stakeholder engagement, including the government, employers, workers, healthcare providers, and other stakeholders in the health sector, insurance sector, and the public to gain support and ownership. FKE appreciates the efforts made by the Minister of Health to seek stakeholders' views and hopes that employers' views as submitted to the Ministry of Health regarding the proposed bills will be taken into consideration and the universal health coverage proposed bills amended to capture the views of employers before being passed by Parliament. For example, the Federation noted with concern that the formal employers have been omitted from the board, yet we play a critical role. Employers are central to the provision and implementation of this healthcare as envisioned in this bill and have always served on such boards alongside trade unions and the government. The authority will largely depend on the contributions of employees in formal employment. This means that accurate deduction and timely remission of these contributions will be done by employers. Hence the need for employers' representation on the board. Kenya has ratified ILO Convention 144 on tripartite consultations and hence recognizes the tripartism engagement. Hence the labor sector representation is not complete when you have only government and workers without employers. Further, the bill refers to employers under various sections, and it's clear that employers' role is envisaged in the bill. FKE should therefore be part of the board. The Labor Relations Act recognizes tripartism in the labor sector. This should not be disregarded in the UHC reforms. This morning, we also woke up to the news that the National Assembly has reduced publication days for the Digital Health Bill 2023 and Social Health Insurance Bill 2023 from the 14 days to 6 days for the Digital Health Bill and 3 days for the Social Health Insurance Bill. This will obviously compromise the quality of public participation. On the Employment Amendment Bill, the bill seeks to amend the Employment Act 2007 by providing for the right to disconnect to employees. In essence, the bill seeks to establish the right of an employee not to be contacted by the employer beyond the contracted working hours unless there is an emergency. FKE does not support the proposed Employment Amendment Bill 2022 for the reasons that, one, the proposed amendments introduce radical and stringent measures that will curtail the employer's prerogative to manage enterprises and pose challenges to industrial relations in Kenya. These proposed changes negate the essence of freedom and the realities of the labor market. The employer's administrative prerogative should not be curtailed by legislation. The changes, in our view, infringe on the employer's right to manage the enterprise on a day-to-day basis. 3, If passed, the bill will create two centers of managerial power and ultimately cause disharmony and indiscipline in the workplaces. The ILO has provided instruments which have been successful in managing working hours and overtime payment. 4, the bill is too prescriptive and requires that employers develop policies to regulate phone usage by employees outside work hours. An employee has the right to keep their phone on or off if it's a personal phone. If the phone is an official one, then the employee is under obligation to use it as required by the enterprise. If the nature of the business requires a shift system or extension of working time to meet the business demands, then such laws which are prescriptive in nature will hamper flexibility in work arrangements. 5, the payment of overtime is already provided for in law under the General Wages Order to address situations where employees work beyond the set hours. Most collective bargaining agreements provide for flexibility in the management and regulation of working time. To our knowledge, no union or employee has raised any concerns to warrant the passing of this law. 6, flexibility is important for the labor sector in the new normal, which emphasizes on results, that's output. The employer and the employee should be allowed to agree amongst themselves on what arrangements work best for them. This bill will make it hard for the employer and the employee to effectively respond to emerging challenges, such as those presented during the COVID-19 pandemic and the new workplace realities that are emerging. 7, the engagement between an employer and employee during and out of work hours is a management issue and should not be legislated. This should be addressed.
Kwa Ramogi